prepare the equipment for the male catheterization as you would for the female catheterization. So you will need a kidney dish, the urinary catheter attached to the urinary bag. You will have sterile water for injection, okay, some gauze which has already been soaked with water for cleaning purposes, okay, your drapes, okay, and some forceps to assist you with the cleaning process. Now the main difference for the male catheterization is that you will need to prepare an anesthetic gel. Okay, so in this case, the anesthetic gel is pre-prepared inside the pack, and you will need to use this when you before you insert the catheter. This is how you should position the trolley, the patient, and the clinical waste bin when you are about to do the catheterization. Remember that this is a sterile field. Okay? After the patient has been cleaned, this area will become your sterile field. So the clinical waste bin where the clinical waste is going to go in should not be somewhere around the sterile fields. Okay, so first put the drape under the patient, and then you will drape with the window over the patient's penis. Okay, bring the kidney dish with all your equipment next to the patient. Okay. For cleaning purposes, we will use the forceps, and for the male, since there is a prepuce, we will clean the penis first, retract the prepuce, and then clean the glands, and then finally the meatus. Okay? So clean it in a single motion, downwards, throw it into the clinical waste bin. Same thing on the sides. And then use the gauze to retract the prepuce and clean the glands. Okay. And finally, the meatus. Once you have done that, it is time to insert the lignocaine gel. Okay. So inject the lignocaine gel directly into the urethral meatus. Squeeze on the glands, okay, so that to prevent the gel from flowing out. And you have to do this wait for 5 minutes. Once the 5 minutes is up, you are ready to insert the catheter. Now remember to tell the patient that you are going to insert the catheter just before you insert it. And also, if you want, let the patient, ask the patient to breathe in and out so that it distracts them from the pain while insertion. Okay? And upon insertion, put the tip of the catheter into the meatus, okay, and push the catheter in. Slowly, okay, without touching the catheter. So this is what we call the no-touch technique. Advance the catheter slowly while pulling on the plastic sheath. In the event you develop some problems inserting the catheter, for example, a resistance, you can either lift the penis upwards, okay, or manipulate the penis to the side so that it is easy for you to insert the catheter. Advance the catheter all the way until you see the urine coming out in the catheter, in the tubing of the catheter. For the males, you will have to insert the catheter right up to the tip. Okay. Now, once that is done, you can see that the end of the catheter is at the urethral meatus. Okay. Inflate the urinary catheter balloon as you would for the female catheterization. After you have inflated the balloon, pull the catheter outwards until you feel that there is a tug and a resistance. That is where the the balloon lies at the neck of the bladder. Okay, tear the plastic away from the catheter, and then you can tape this to the patient's leg. Okay, and of course hang the urinary bag over the edge of the bed. Remember to push back the patient's prepuce into position to prevent paraphimosis. Okay? And that's the end of the male catheterization. And you can remove the drapes and dress and clean the patient. Now, if you have an indwelling catheter, you will have to remove it at some point of time. For removal of a urinary catheter, what you will need is a syringe, which we will use to withdraw the distal water that was inserted when you inflated the balloon. Now, it is very important for you to know how much distilled water was inserted during the inflation of the balloon so as you do not leave any residual water in the balloon. Once that is done, use the gauze, retract the prepuce slightly and gently remove the catheter from the patient. Okay? Once you have removed the catheter, put the catheter and dispose of it and push back the prepuce to its normal position, and then you can ask the patient to clean himself.